Good afternoon, everyone, and welcome to the Nurse's Corner with your nurse, TANEISHA COLQUHOUN. This afternoon, our topic will be periodontitis. According to the Merck Manual for Medical Information, periodontitis is a severe form of gingivitis in which the inflammation of the gum extends to the supporting structures of the tooth. It is also called pyorrhea. Periodontitis is one of the main causes of tooth loss in adults and is the main cause in older people. Infection erodes the jawbone, which holds the teeth in place. The erosion weakens the attachments and loosens the teeth. An affected tooth may eventually fall out or it may need to be pulled out. Causes. Most periodontitis result from a long-term accumulation of plaque and tartar between the teeth and the gums. Pockets form between the teeth and gums and extend downward between the root of the tooth and the underlying bone. These pockets collect plaque in an oxygen-free environment, and this promotes the growth of aggressive forms of bacteria. If the disease continues, eventually so much jawbone near the pocket is destroyed that the tooth loosens and could actually fall out. The rate at which periodontitis develops differs considerably, even among people with similar amounts of tartar buildup. That is because plaque contains different types and numbers of bacteria, and because people have different responses to the bacteria. Periodontitis may produce bursts of destructive activity that last for months, followed by periods when the disease apparently causes no further damage. Many diseases and disorders, including diabetes, Down syndrome, Crohn's disease, leukopenia, and HIV/AIDS can predispose a person to periodontitis. In people with HIV/AIDS, though, periodontitis or pyorrhea, it progresses very quickly. Symptoms. The early symptoms of periodontitis are bleeding, red gums, and bad breath, otherwise called halitosis. Dentists measure the depth of the pockets in the gums with a thin probe, and x-rays show how much bone has been lost. As more and more bone is lost, the teeth loosen and shift position. Frequently, the front teeth would tilt outward. Periodontitis usually does not cause pain until the teeth loosen enough to move while chewing, or until an abscess forms, and that is a collection of pus until that forms. Treatment for periodontitis. Periodontitis usually requires repeated professional care, meaning we have to go to a dentist to get it treated. A dentist or periodontist may access the tooth below the gum line surgically and thoroughly clean the teeth and correct the bone defects caused by the infection. A dentist may also remove a part of the infected and separated gum so that the rest of the gum can reattach tightly to the teeth, and the person can then remove the plaque at home. That process is called gingivectomy. A dentist may also prescribe antibiotics such as tetracyclines or metronidazole or Flagyl, especially if an abscess has developed. The dentist may also insert antibiotic impregnated materials into deep gum pockets so that high concentrations of the drug can reach the diseased area. Periodontal abscesses cause a burst of bone destruction, but immediate treatment with surgery and various antibiotics may allow much of the damaged bone to grow back. If the mouth is sore after surgery, though, another treatment method is to use a chlorhexidine mouth rinse, and that can be used for 1 minute twice a day, and this may temporarily be substituted for brushing and flossing, because after surgery the mouth will be a bit sore. That is today for periodontitis. Thank you for listening. Before I go, I would like to leave with you the health tip for the day. The health tip for today is: life is short, smile while you still have teeth. Again, life is short, smile while you still have teeth. I'm TANEISHA COLQUHOUN, and thank you for listening to the Nurse's Corner. I will see you again, same time, same place, right here on Tops Radio, where we will be discussing another health topic. Have a wonderful afternoon, and please remember, a healthy living is not a goal, it is simply a way of life.
Tops Radio and Associates take no responsibility for the opinions or statements made by the host or their guest. Statements or show topics are not necessarily the beliefs of this site or this radio station. It's not our intention to libel, discriminate, make hate, or annoy anyone. This site or radio station takes no responsibility for the opinions of others in the postings of comments in chat rooms or forum posts.
Ladies and gentlemen,
the number one station. The number one station.
It's always hot.
Tops Radio.
It's always on.
Big Bad.